So what are our results so far? We've completed the pilot study of 20 whole genome screened together with the panel tests. We've also had, as well as that, our action study, which is an ongoing study where people are paying for having their genetic tests done. And so in total, with all that we've done so far, we've done 51 patients. And what's come out of that? Well, for everybody, they get the gain of pharmacogenes, how you metabolize drugs. And that's been hugely useful. We found people who have disorders, that means they're ultra-rapid metabolizers of certain drugs, so certain drugs will be just gobbled up so quickly they're not going to work in that patient. We've had drugs where they should be given reduced doses. So we've learned a lot that everybody gains from pharmacogenes. In terms of major genes, how likely you are to find a major gene depends a bit on what your family history is. So if you have a strong family history of breast or ovarian cancer, we're much more likely to find genes like BRCA genes. If you have lots of endometrial cancer and ovarian cancer or bowel cancer, then may be that you have a Lynch syndrome gene. And we found a BRCA1 gene. We found, so far we've actually had 2 Lynch genes and 1 outside the study, which will make a major difference to people. Separately, we found genes for iron overload, hemochromatosis. We found genes for nerve cell sheath tumours, an SDHA gene. We found genes for increasing people's risk of clotting, particular type of gene that does that. So those have been really useful for those people and will reduce their risks. And we've also found some other people who had genes associated very closely with BRCA, not quite BRCA, PALB2 and also a BARD1, and those people will have extra breast screening and may have their ovaries out, and one has had their ovaries out already because the risk of ovarian removal once you've had your family is so low, at less than 1% of major incident, that once in the NHS they will take your ovaries out once you've had more than a 10% lifetime risk. We probably feel it can be considerably lower than that just due to the poor effect of ovarian screening. So the results are exciting that we've had these major genes, and we've also had a lot of pharmacogenes. And then we see the huge number of carrier genes that will enable those people who have those genes to maybe consider having their partners tested before they have children to reduce that 1 in 300 risk of having what can sadly be a very horrible recessive disorder. So it's been hugely beneficial. We've had slightly more major genes than we'd expect. We had, in the first 27, we had 7 major genes, and that was larger probably because some of these had strong family histories. So I think it's incredibly impressive what the results and what you can do it. It's a huge leap in medicine and a great excitement to do in general practice, which is the right place to do genome screening. That's where the doctor who knows you best can help you and has the contact with the right people. So we're very lucky to work with an amazing team of 5 very dedicated geneticists who've given thousands of hours of their time on this project, often, just hugely dedicatedly, and so we're unbelievably grateful, and we think we've built something that's very special. Thank you.